I'm Jace Tanner. I'm here with Emma Gregory, reporting from Vancouver's downtown east side, a neighborhood with severe issues, amongst them poverty, homelessness, and drug overdose, all of which have intensified with the pandemic. Today we present Moms Stop the Harm, an advocacy group for parents who lost their children to the opioid crisis.
We are part of a group called Moms Stop the Harm, which was founded several years ago by a couple of mothers who lost their children to this opioid crisis. And they decided to start a group to give support to other parents and family members that are going through the same thing and to advocate for change in this province and across Canada.
I'd like to add that one of the biggest challenges for families that lose their loved ones this way is that their lives are not validated by government officials and enforcement agencies. No one wants to know who caused their death. No one wants to pursue the people that caused their death. That never happens with any other kind of death, only this kind of death. It is overlooked, and that's why the grief is so terrible.
I lost my son in January this year, and he basically spiraled downwards once the pandemic hit, and he was dealing with depression and anxiety, and he wasn't able to find work, and he had recovered from an opioid addiction previously, but he relapsed this year. So the numbers are increasing steadily during the COVID pandemic.
And both myself and my friend here, Dawn, both our children died in supportive housing or treatment facility.
Are any of you from this particular neighborhood? Are you from other parts of Vancouver?
From Burnaby. This is what really drives us for me of wanting to raise the awareness, is that when everybody thinks about the opioid crisis, they think about the downtown east side. But it's happening in every corner of this country, in this province. And my son went to Catholic school and played football. I'm a professional accountant, and it happened to my family. But people automatically think it's only happening to people that are in marginalized communities, and I really want to raise the awareness that it's your neighbor, it's your cousins, it's astounding how many people are affected by this, and you just don't know it because of the stigma, so people are keeping it secret. Yeah. And that's why they die alone. My son died alone on his bathroom floor trying to hide the fact that he had relapsed.
Same here.
Same here.
So can I ask you, if you live in other parts of town and you've chosen to come down here, what was the particular reason for coming to the downtown east side?
There was no event in my town. I live in Langley. But my daughter lived in Vancouver, and many of the people here today knew my daughter.
Yeah. This neighborhood brings a lot of people together around these similar issues. So,
Yeah.
What kind of changes would you like to see? Do you have?
Well, safe supply,
Yeah.
obviously, because whatever you're taking these days, I mean, you don't know where it's coming from, and almost everything has fentanyl or carfentanil in it.
Yeah.
And it's like playing Russian roulette. Safe supply, definitely. And decriminalization, also reducing the stigma so that people can ask for help instead of hiding their disorder.
If anybody had a different kind of disease or medical condition,
Yeah.
our society would not turn them away.
Exactly.
They would not. They would help them. And they would provide care and medicine.
And actually, that's a really good point, because another thing that really needs to change is the availability of treatment for these people.
Isn't much.
There's not much there.
Yeah.
And private treatment is tens of thousands of dollars just for a month or 2 months.
It's ridiculous what we have to pay to keep our kids in treatment. We have to mortgage our homes to get them in treatment. It's
Yep, it's true.
thousands of dollars. It's a shame.
and even then, I know some people whose parents forked out, rehab money like 4 or 5 times,
Yep.
and it still didn't do the trick.
That's
And
right.
So it's just like there needs to be other options.
You know, the sad part too, when they relapse in treatment, they kick you out.
Yeah.
You know, our children are so vulnerable like, where do they go? They end up on the street. How fair is that?
Who does that to someone with an illness in the hospital?
Right.
You smoke a cigarette when you have cancer, do you get thrown out on the street?
Yeah.
Exactly.
Yeah.
You don't get thrown out on the street, you have your cigarette and you go in and get chemo.
Someone that's addicted to cigarettes doesn't get treated like an outcast and denied medical treatment when they develop a significant illness from their addiction.
There's a stigma about drugs that like, oh, you're doing it, you choose.
Yeah, you choose to do it.
yourself.
None of our children chose this.
No.
I think
No.
also the stigma of calling it an overdose, I actually find it extremely offensive.
Exactly.
They did
Same
not
here.
overdose, they were poisoned.
Yes.
And so if any other human being was poisoned, there would be some kind of investigation on who.
Yeah.
So we're constantly being told
An overdose.
it's an overdose, which is then putting the onus on the person that took the substance.
Yeah.
Yeah.
So
That
now
has
that
to
we
stop.
have legal marijuana and someone decides to take a pot brownie, but someone else decides to put fentanyl,
Yeah.
did they overdose on their pot brownie or were they poisoned by fentanyl?
Yeah.
We have to call a spade because every time we turn around and we call it an overdose,
Yeah.
we're then condemning people one more time and stuffing them down into a box
If you
because
read
they
it,
don't want to
yeah.
they don't
Yeah.
want people to know about it.
The
Yeah.
coroner's report does not mention overdose.
Well, for sure. And even if they were to like ingest like a larger amount of drugs than before, that's still like, by the time you're at that level of like using, it's usually not because your life is so great.
But that's not what's happening. There's been heroin
Yeah.
users for decades. There's been cocaine users for decades.
Yeah.
They're not dying all over the place in the 60s and the 70s.
Yeah.
It's now because of what's in it.
And you know, our children were professionals. They had jobs. They were
Yeah.
chefs. They were artists. They were, you know, they had skills. And this is how they got treated. It's so,
And they were loved. You know, they
mattered.
They
were-
mattered.
They mattered. They were loved and they loved their families back and their friends. And how can their life just be totally discounted?
you know, we're getting all this media today. Tomorrow,
It's gonna
like
go
nothing
away.
happened. We won't hear about the crisis anymore. All we hear is COVID.
Yeah.
And this has killed more people than COVID.
Oh, for
Yeah,
sure.
and
Yeah.
continues to do so on a daily basis. The numbers are higher every day.
Is there something about the media messaging around COVID? It's like very difficult to like pursue anything because it's considered being, I think, like challenging to the health authorities, which need to function in their particular way to get their message across. But this is a legitimate concern. I think they're just kind of hoping that when the vaccines come, everything can go back to normal. But it's just kind of like the fentanyl crisis was here before.
It will still continue.
Yeah, and people's mental health are really suffering right now.
Yeah.
I mean, I know my son really struggled with anxiety and depression through this, and that's one of the reasons that he relapsed.
Yeah.
And so you're seeing the numbers getting higher and higher, and they're not going to stop. It's going to keep getting higher. It's just getting worse. And,
Yeah.
there's no support. You can't even go to see a counselor face to face. I had an appointment with an addiction specialist 2 days before my son died. He was supposed to, or after my son died, he was supposed to see him.
Yeah.
And it was going to be on the phone, not face to face. It's really difficult to connect with somebody when you're dealing with that kind of vulnerability, when you're talking on the phone to a
It's
stranger.
one of the things like you go to the counselor and then you sit there physically and like you like exchange energy with them, whatever we want to say it, but then you leave the counselor and it was the thing you did that day, like you just put down the phone after talking to somebody. There's no like buffer zone between like picking that phone up again and calling your drug
Yeah,
dealer.
yeah,
And you're
exactly.
raw. You're raw. You've just exposed some stuff.
Yeah.
And then what do you do with that?
Right? The government has to change the medical model.
Yeah.
I mean, these people have to be taken into care. When they arrive in emergency, they need to be treated as urgently as someone that arrives with a
Respect.
heart attack.
With respect.
And as urgently. And why the funding keeps getting cut for places like safe consumption sites or beds in the middle of the winter?
Yeah.
Do you imagine if you had a heart attack or you had in a car accident, but they said to you, well, at 9 o'clock, emergency's closed. We'll deal with you tomorrow. And that just keeps happening over and over.
I joined Mom Stop the Harm shortly after Alex died. I'm now the new treasurer of Mom Stop the Harm. And Mom Stop the Harm is just, they organize this attendance at this rally. So,
And the membership is just skyrocketing in that organization. It went from 1,200 to over 2,000 in 1 year.
yeah. And that's just the people that have found. I had never heard of Mom Stop the Harm. I wish I had, because I think I would have maybe had some more tools to help my son in his struggle.
Me too.
Me too.
Me too.
Me
And
too.
another thing we'd like to do is get the awareness of Mom Stop the Harm. We have
Amazing.
two
They
groups
are.
you participate more. They're
Yes, I
healing.
do. Healing Hearts. It's Healing Hearts as well, which is affiliated with Mom Stop the Harm. So it's a briefing that we meet once a month.
And then there's Holding Hope, which is for families that have members that are struggling with substance abuse but have fortunately not left us to help give them support as well.
You just heard from Mom Stop the Harm, parents who have lost a child to the opioid crisis. They want safe supply and harm reduction, and they want their voices heard. To get in touch with them, please visit their website at momstoptheharm.com. Thanks to everyone who took the time to talk to us.
It means a lot when people take the time to share their personal lives.